Hello, this is Donna Smith talking to you from Laurel, Maryland, my home just north of Washington, D.C. And I'm one of the people who appeared in Michael Moore's movie, SiCKO. And I've been talking with some of my other friends, the patients who appeared in Michael Moore's movie, his 2007 movie, and we've been trying to decide if the healthcare reform that's going on in Washington right now really is what would have helped us, would have kept us from suffering the things that we did. The answer is no, sadly, and let me run through a few of the stories very quickly so that you know this particular markup of the legislation, a markup by citizens, by people who've been hurt very badly by the current healthcare system, can show you that this reform is not right for the nation. We'll start with Tracy Pierce, 37-year-old man from Kansas City. His wife Julie told his story in the film. Tracy died, not necessarily of his kidney cancer, but from the denials and delays of his insurance company that blocked almost every treatment that his doctors thought might give him a fighting chance at life. What happened to Tracy will not be prevented by mandating that every American buy private health insurance. What happened to Tracy will not be prevented by saying that insurance companies will have to cover people with pre-existing conditions. None of that will matter when you get sick. If they choose to deny a certain treatment or delay approval of that treatment or do any of the things they did to Tracy, the result could very much be the same, that you or a loved one could die while they delay and deny. Virtually the same situation for little 2-year-old Michelle Keys. Donnell told her story in the movie. She took her daughter to an emergency room. It wasn't an in-network emergency room, so she had to take her to another one. They wouldn't treat her at the first emergency room. A 2-year-old died because an insurance company didn't think she was in the right emergency room. Anything in the current legislation in the House or in the Senate that would prevent that? No, there isn't. Michelle would still die. How about the 9/11 rescue workers? Reggie Cervantes, Billy Maher, John Graham. How would they fare under the current legislation? Not much better. Their care could be denied. What happened to all of them happened to thousands of 9/11 rescue workers, the heroes. You remember them? That we all thought were so heroic, who ran into Ground Zero on that horrible day. Well, guess what? The insurance companies would still be able to deny treatment, delay care, not pay for things that might help them live a more productive life, live a healthier life. Nothing in the legislation would prevent Reggie from being denied the treatment that she needs to feel better. How about myself and Larry, my husband? We went bankrupt, lost our home, lost everything we worked a lifetime to achieve because we didn't have enough insurance, even though we had private health insurance, disability insurance, and a healthcare savings account. Still wasn't enough because the out-of-pocket maximum exposure for our policies were too high. Left us terribly damaged financially. First sold our home to pay off some of the bills, and when that wasn't enough and the collectors kept coming, we had to go bankrupt to even be able to stay afloat and pay premiums and continue to get medication and treatment. Is any of that prevented under the current legislation? It certainly is not. And right now, I'm struggling and fighting a battle to get my own health care, even though I have insurance with one of the major big insurance companies. They're still denying and delaying, won't give me the medications my doctors want me to have, delaying the tests and treatment. How about Adrienne Campbell, the young woman who slipped over the border into Canada with her little daughter Aurora? Adrienne had cancer. Adrienne's insurance company decided that the surgery that her doctors administered should only be given to women who were older than what Adrian was at the time. Anything in this legislation prevent that? Prevent a young woman from having a reproductive cancer, being treated by her healthcare providers and then having payment denied? Nope, not a thing. No protection there either. So what are we saying with this legislation? Who's actually protected? Marginally, more people will get health insurance. But will more people really get the kind of health care that warrants the definitive statement that President Obama made when he was candidate Obama? Healthcare is a basic human right. And no American should go begging, like all of us who appeared in the movie SiCKO have had to do, over and over again, like we are somehow defective, even though all of us purchased private health insurance. The flawed product is not being fixed. What's happening is we're expanding it to more people, saying everyone will have to buy it. Those who can't afford it, where taxpayers are going to subsidize everyone buying it, but it does little to say what that coverage will actually protect. Certainly not our health, I've already told you that. Certainly not your financial status, I've already told you that. So who's it protecting? Protecting the big insurance giants, the pharmaceutical giants, the large corporate healthcare providers, and I'm afraid it's still protecting the politicians who are getting an awful lot of campaign money from all of those people. But I'm trusting there's still some ethical leaders out there, I really still believe there are, who can listen to this SiCKO's markup and say, we know it's wrong. We're going to send letters, all of us who appeared in the movie, outlining what our situation is to President Obama. We're going to send him another copy of the movie, even though we know you all got one 2 years ago. We're going to send another one to President Obama. Because even though we've apparently been forgotten, and what happened to us, the lessons have not been learned, we haven't forgotten any of you. Because you're the ones who could fix this system and have not done that as yet. And we're going to trust you're going to do it. You don't want to leave a bunch of us out here hurting like this. Thank you, and let's really reform this system and extend the basic human right of health care to every American in a Medicare for all-like plan. It can work. We know it can work. Let's just do it.